Hi, Dr. Kevin Zorn, founder and director of BPH Canada, here to talk to you today about the Foley Catheter, the small little silicone or latex tube which was developed in 1943, patented first in the US for the drainage of men's bladders, also women's bladders. But in the case of men, as we get older, that little prostate continues to grow and eventually continues growing. That transition zone occludes the central passage and we get urinary retention. So many men unfortunately find their way in the emergency room unable to urinate, and this is placed in their bladder. There's a small balloon to prevent it from retracting, and this external part has a part for the balloon filling with saline, and the other output will connect to a drainage bag, either a leg bag looking like this or a larger overnight bag that's kept in place. So that's sort of our temporizing measures to drain the bladder, help protect the kidneys from overdistension and what we call renal failure, and then leads the patient to their various solutions, be it medical or surgical. And so that's one of the reviews of the Foley catheter, the management, something that's done by the patient, eventually to move on to a procedure. So same time we have our newest, latest technology called the Aquablation. It's a robot executed handpiece here that drives a high pressure water outflow, almost like a windshield wiper, which will pass between the bladder neck to the tip of the prostate at very high pressures. And what that will do is restore that opening, open up a 4 by 5 centimeter central cavity, kind of like opening up the central part of a donut or of a bagel, and allowing for unobstructed flow. So high pressure water, it's ultrasound guided. We actually map out based on that individual's anatomy everything we want to treat. Is it our median lobe? Is there a lot of asymmetry one side or the other, the different angles? And the most important, we protect that collar around the urethra near the verumontanum that protects the ejaculatory function and really prevents any stress incontinence. So compared to the laser techniques, the HOLEP, and other types of advanced laser techniques, there's still a lot of stress incontinence. Urinary leakage when the patients cough and sneeze. Up to 20% of patients will have that. So with the Aquablation, less than 0.1%, very, very low. There's not a lot of fulcruming, there's not a lot of mechanical disruption of the sphincter because it's all in access and all done within under an hour. So if you're interested, if you have any loved ones with a Foley catheter and looking for some Foley freedom, protecting their bladder, look into the various other solutions other than TURP. There's lasers and there's now Aquablation. So we're proud to be the one and only place really in Canada offering Aquablation to any Canadian man who's suffering from BPH. Give us a call, learn more about your different options at bphcanada.com, and we look forward to helping rejuvenate, restore your normal way of urinating, have a better quality of life, and protect those other quality life functions, including sexual and urinary continence.